Are you a hospital or community pharmacist and ever wondered what a PCN pharmacist actually does? Yeah, me too. I was in that position up until recently. So anyway, let me explain to you what a PCN pharmacist does. Hi everyone, if you're new here, my name is Osama. Welcome to my channel. I've been a pharmacist for 23 years in England. So when I applied for my current PCN position that I've been in for almost 2 years now, this was way back in September 2021, when I tried to do some research as to what a PCN pharmacist actually does, it was pretty difficult to find a definitive answer. There was a few things online, some videos, YouTube videos, but nothing really explained properly what a PCN pharmacist does. So this is why today I thought I'm going to go through it and explain bit by bit what a PCN pharmacist actually does. Let's just cut to the chase. The main role of a PCN pharmacist is essentially to help out GPs and to help out the surgeries in the ever increasingly complex world of drugs in the NHS. There is a layer of drug complexity that is blanketing our health services, and that's where the PCN pharmacists come in to try and strip down, try and optimize these drug complexities. Let's go through some of the main roles of a PCN pharmacist. This is in no particular order, this is just straight off the top of my head. Out of stocks. Okay, so if you're a pharmacist in the UK, I don't need to tell you about this. Out of stocks are an absolute nightmare at the moment. So a lot of the tasks that I get sent in my day-to-day job is drugs that are out of stock. Being a pharmacist, we are ideally placed within the NHS and especially primary care to navigate the complexities of drug shortages and to find suitable alternatives. Medication reviews. So this is another big, massive thing that we do within the NHS. So this could be reviews that a GP wants me to do with the patient, or it could be another profession within the surgery like a nurse or a paramedic, or it could even be a patient-led review. A patient may well phone the surgery up and say, look, I want a review of my medicine, so they'll pass that request on to me and I'll book the patient in for either a telephone review or a face-to-face review. MDTs. So if you're wondering what MDT is, it means multidisciplinary team. So I will have meetings, say, every 2 weeks with fellow health professionals such as nurses and doctors, where we get together and we have a virtual team meeting where we discuss residents in some of the care homes that we look after. So again, this is quite an important role that I do, because they seek my input into what the patient's medicines are and if we can change or optimize any of them. Audits and QoF work. So audits can be, for example, say you want to do an audit on how long people in your surgery have been on bisphosphonates, for example, or an audit of people who are on high-strength painkillers, more than 120 milligram morphine equivalent a day. The QoF work, that can be stuff like, for example, something that I'm doing at the moment is the cholesterol QoF work, where we're looking to optimize patients who are already on statins, and if they're not on statins, to get them on a statin. Talking of statins, another job that we do is to initiate drugs. So a common request that I get is a patient will have had some blood tests, the doctors will have reviewed the blood tests, and then they'll send me a task to try and convince the patient to go on a statin because their Q risk is above 10%, for example. Another job that we do is reviewing test results. So this could be someone's cholesterol readings, or it could be their HbA1c readings. So maybe I've initiated them on a new statin drug or a new diabetes drug. So many months down the line, I want to check their blood results and change the therapy if needed, depending on the results of those blood results. De-prescribing. De-prescribing, this is a favourite of mine. So how many times have we come across patients who have been put on, say, lansoprazole 30 milligram for a slight bit of heartburn, for example, that they had 10 years ago. They really need to be on 15 milligrams. So the amount of times I come across this where I'm lowering PPIs down from 30 to 15 milligrams, sometimes even stopping proton pump inhibitors. Another classic one is opioids and your gabapentins and your pregabalins. So again, we get patients who are put on sky-high doses of these, and my job is to come along and try and reduce the analgesic burden that these patients are suffering with. And another one is not really drug-related, but more to do with vaccination. So in the primary care network that I work in, we're heavily involved with the COVID vaccination campaigns and the flu campaign. So I will go out with a team and we'll say visit a couple of nursing homes within a day, and we'll go around and we'll administer some flu vaccines and COVID vaccines at the same time. So that makes a nice little change from sitting in front of a computer. It's sort of instead of practicing my soft skills, I get to practice my hard skills like vaccination. So it's a little bit more hands-on, so it makes a nice change of pace from my usual drug-related job. So this list that I've gone through, it's by no means exhaustive. I just thought it'd give you a little bit of a heads up as to what a typical primary care network pharmacist, GP pharmacist does really. I hope it sort of demystifies some of the vagueness about what we do, because I think a lot of professionals, a lot of people don't actually know what we do, and they even question whether we're needed. If you work in the NHS, you'll know that there's a never-ending list of jobs to do, whether you're in community pharmacy, hospital pharmacy, primary or secondary care. So being a pharmacist, I am never short of work, thank goodness. Anyway, thanks again for your time, and I appreciate you watching all these videos and all your comments and likes. It really does mean a lot knowing that I'm helping other people out there. Hope you like it, hope you learned something today, and I can't wait to see you in the next video. Thanks very much. See you later, guys.